Thank you for being a part of this event, which is, very important to us. As you know, we are, this year incorporating the United Nations agenda of people, planet, prosperity, partnership, and peace. And this particular discussion looks at the people banner and specifically people's healthcare and their access to it. My name is Craig Turp. I'm the editor of Emerging Europe, and I'm joined for this discussion in one way or another by three fabulous guests. First of all is Kostas Deligiannis, who is the General Manager of GE Healthcare for Eastern Europe. He's with me here in Brussels. And we also have with us, via the wonders of satellite, or whatever they use these days, Irma Veberic, who is the General Manager for Poland at Roche, and Jan-Philipp Beck, who's the CEO of EIT Health, which I'm sure some of you know is a network of health innovators backed by the EU. So thank you, to the three of you. The reason that, I think Andrew mentioned this in his introduction, the reason that the numbers in the room today are, fewer than we would usually have with us, it's because of the difficulties caused by COVID to international travel, which obviously persist. So I think that any discussion about health would be very awkward, actually, if we didn't focus a little bit on COVID-19. I certainly don't want it to be the center of the discussion, but I think it should certainly be at least a starting point from where we can perhaps, move on. Not least because over the course of the past 18 months or so, we've seen a wealth of innovation in, the health sector. Obviously the most important one is the vaccines, which were developed so quickly, but, diagnostics, AI, telemedicine, has taken a huge leap. But my first question, which I'm going to put to all of my guests, is, it's to do with a concern that I know a lot of people in the health community have at the moment, and it's that we've had, all of this innovation. The vaccines are, the most important one. But in some countries, particularly in our region, in Central and Eastern Europe, there is a large minority, and, in a couple, Bulgaria and Romania in particular, it actually looks as though there's a majority of people who, for one reason or another, are not willing to take their medicine, as it were. So, my first question, and, I promised you, Kostas, I'm not going to monopolize you just because you're in the room, but, I'll give you first dibs on this one because you are here. To me, this is not just about vaccines. If people start refusing one thing, they could start refusing others, whether it's, AI diagnostics, telemedicine, and it could end up making all of this innovation that we're seeing redundant. How do you feel about this?
Well, first of all, thank you for the invitation. It's a very good question. I think this crisis, this healthcare crisis, showed a lot of things, and it was a small apocalypse for everybody. To your question about the vaccination and the acceptance of vaccination and other things related to the health crisis, I think what we saw is a huge gap in primary healthcare, huge gap. And this not only in our region, Emerging Europe region, but also globally, everywhere. Because exactly the role of the primary healthcare structure is the local community care. And this means also consulting. So the relationships of doctors and educated personnel with the local community are not there. We don't have primary health care, and even where we have, is not accepted. That's another thing, because primary health care, community centers, doesn't mean only being accessible, affordable, etc. It means also being acceptable. The quality of primary health care has been abandoned for so many years that even where there are such centers, community centers, people don't trust them. So what people do is that they run, when there is a problem, they run to the hospitals, to the emergency departments, and they try to get treatment there, according to their own view. But all the background, all these really deep relations of trust that should really strengthen health are not there. So vaccination, yes, people don't accept. Why? Because they don't know. They are not educated. Nobody talks to them. Or if somebody talks to them through TVs, etc., it's not a person that they have built any personal relationship to. So your question really is exactly this. We need really to strengthen primary healthcare. There must be a plan there.
Okay, I'm going to come to Jan-Philipp now, because I know that we had a chat about this just a couple of days ago. So, I know you've got some thoughts on this subject.
Thank you very much, Mike, and thank you also for having me here. So, look, I think for the question of vaccination in particular, but maybe also you mentioned, these other big trends and changes that we see, for example, the advent of digital technology and so on, that people might have reservations about. I think, one thing that we need to consider, which is a big topic, is that I think we are targeting people who are generally healthy, right? I think that's very important. And we do that through the healthcare system infrastructure. And so I agree very much that from my point of view, also the primary healthcare needs to be strengthened. But I also think that we need to understand that this requires a broader citizen and patient engagement. And I think it's all about trust. It's about involvement and trying to build broad coalitions also of actors that can facilitate the involvement of people by and large in getting their concerns raised and clarified, but also explained, right? And I think particularly also for new tech, digital, AI, all of these things, I think their success will so critically depend on winning people over to trust those, and I think that cannot be achieved by the healthcare sector and the government alone. But it requires the involvement of many who have trust in communities. I think this is absolutely essential. And then I think on vaccination, I don't believe that force will do essentially the trick. I think it would lead us down a very challenging path. So I think we have to convince, and we have to focus also on those that, and I think there's still a relatively large proportion of people who are not vaccinated to date, where the availability is generally there, who are not fundamentally against it, but they can be convinced if some of their concerns are maybe addressed and accessibility can be eased sort of around their environment. And I believe that's what we ought to focus on. And then again, yes, engage the doctors, be it in companies where people work or so on, but go also broader, right? Where people are involved in, where they are doing sports, where I think that will be absolutely key to get ambassadors around this that can reach people that goes far beyond the healthcare system actors. So those are my 2 cents to this.
All right, thank you. I'm going to come to you, Irma, now. How do you see this problem?
Similarly, good morning, first of all, and thank you very much for the invitation. What to add to, I fully agree with both speakers. And for me, in the center, we have trust. And it seems that in the countries where we are really below, and unfortunately, I'm originally coming from Slovenia, and Slovenia is also one of those countries, the trust is broken. There is no trust. And personally, I believe is not just about the healthcare professionals. It's more like how much I trust politicians, how much I trust media, and how much I trust healthcare professionals. And where we are low, this is completely over, gone, doesn't exist. So for me now the question is, what can we do to turn this and to engage in a way that we will have a collaboration and that people will start to believe in science? And yeah, we made several mistakes, especially in the countries with low percentage, but there are countries with a super high percentage, for example, Denmark, and we can learn from those countries because there is a formula for success. But on the other side, we have so many positive learnings out of COVID, so that I would rather look to those positive learnings and what were the formulas behind. And if we stay with the vaccination, for me it's like, the way COVID vaccination was brought to Europe is something we can be proud of. It was in a quite record time. Now, in majority of countries, we have enough vaccines presence. And if we look, what was really working well, it was around, we have a common goal. We need vaccines across Europe. We have a sense of urgency collectively. We have a mutual trust at that time. And when we combine all those efforts and we were able to break down the silos, and we were able to refocus this divergent interest we have, that was the formula for success. So whatever we do, we really need to have a common goal, we need to have sense of urgency, and we need to work together. And the same is also for increasing percentage in those countries where we are not on the level we need, because for being healthy and go back to, I would say, the new normal life, we need this. We need. So that's just few thoughts from my side.
Jan-Philipp, I'm going to come back to you next because I saw you nodding quite vigorously there just a moment ago.
Yeah. Just very briefly, I think Denmark is an interesting case, as Irma mentioned, right? So I think maybe this can also stand as an example. So first of all, also, Irma, I would fully agree. I think, honestly, if we look at trust levels, there's a number of people that don't tend to trust governments and government campaigns. And I would say, with all fairness, the pharmaceutical industry is also not super high in those trust rankings. Now, these two come together. That's a challenging bit right from the start, yeah, and then with the needed speed. Now, Denmark, I think, might be interesting because I think Denmark has now abolished basically all COVID restrictions. And I think as we follow that, maybe this can also be very pragmatic on two sides. One saying, look, many people are vaccinated, and I would think we will see that there are no detrimental effects on population health whatsoever from those vaccines, but quite the contrary, probably they will hopefully fare well with this concept, and we can maybe show that this is indeed a pathway for society as a whole to actually get the problem under control, as opposed to very costly and constant testing, right? Which seems to be something that people, maybe some got used to and said, well, I just got tested all the time, which shouldn't be the better alternative, so to say, although it's of course less invasive. So yeah, those were just my quick reflections on what you said, Irma, which I liked very much.
All right, thank you. Kostas, I'm going to put the next question to you. Do you feel that, we're still kind of on the topic of COVID now, but moving, slightly away from it. And, I think one of the problems we faced is that because so many resources have been focused on COVID over the past 18 months, is there a danger that we've focused too much on that particular problem at the expense of, other sides of the healthcare problem?
First of all, we saw some problems already last year, especially with cancer treatment. Big delays there. I think in Europe there were some studies that were quite shocking. In Italy for breast cancer follow-ups, and from Euroastro on therapy sessions delayed too much. So definitely there were problems. Now the question for me is the opposite. Did we directed the resource that we could direct to COVID or not? Because I believe that a very big part of resources in Eastern Europe, let's talk about us, for emerging Europe, has been left redundant. And I'm talking about private healthcare, where it's a huge pillar of healthcare in every country, especially in our countries, and it proved that it was not part of any response plan. I will give you some examples. In Greece, the private healthcare sector holds over 15,000 of beds, and it was left idle for months until they tried to engage it in the response plan. And we have countries like Poland or Romania, where the private healthcare sector has more than 30% of the primary healthcare capabilities. So we talked about primary healthcare, but also the private sector. I think it's this crisis showed us that it's time for the governments to accept that they have two pillars of healthcare, the public and the private. And they will always have these two pillars, no matter what is the policy, the government politics, or whatever. They will exist. So they have to marry them and put them in the strategy for the future.
I mean, when it comes to, you know, these two pillars, I mean, are there, you know, you mentioned Poland and Romania, you know, would you say that they were good examples of, you know, where, you know, the private sector is actually being utilized?
I think finally we came down to a good synergies and collaboration.
And how did that come about? I mean, you know, got any ideas?
Now
as to
the
how this
dynamics
might happen?
depends on the country.
And how would we go about, you know, making it happen elsewhere? That's
the dynamics depend on the country. There were countries that they were a tough way to find the kind of modus vivendi and try to face together the crisis. And I would say Greece is such a case. There were countries actually that also some private facilities were confiscated at the beginning. And there were countries that this came through much more mature discussions, like in Romania. So I believe that finally it proved that, yes, they can work together, and they have to work together. Now, for me, the challenge is to take it a step back earlier now and make a plan for the next 10 years, how these two pillars can be part of the healthcare map in the country and response, and can make a response, can shape a response to such crisis.
Mm-hmm. Irma, I'm going to come to you. You know, Kostas mentioned cancer there, and I know that Roche is, you know, deeply involved with cancer care. I mean, how do you, you know, feel about what's happened over the past 18 months in terms of, you know, how cancer treatment has been affected?
In a shortest possible answer, I would probably say significantly. So there is no doubt that cancer patients are not treated as they were treated before COVID-19, that's for sure. There are different analyses done. But what I'm afraid, you know, when we will really see probably next year what is the size and scope of the impact we will have due to the COVID, it will be probably much bigger than we imagine now. Because you know that in the wave 1 and 2, we almost stopped treatments. Now we are somehow coming back and treating patients again. So to answer your question, you know, are we focusing too much to COVID and we are forgetting all other areas? Probably yes. But COVID-19 was able to show us how ineffective and inefficient systems are. You know, not just in our part of Europe, so in emerging markets, also Western Europe is suffering. So that's absolutely now crystal clear that the model we were using for years is broken. So now the question is how we will address this. We talk also about the private and public, and I'm trying to find, you know, what are those nice stories or good stories where we can maybe get inspiration. And coming from Poland, and with Jan, we were together in June when we have officially opened the Warsaw Health Innovation Hub. And Warsaw Health Innovation Hub is a joint project. It's the first public-private partnership in Europe, and I would say also probably unique platform in Central Europe. And I would say maybe we can learn from such a kind of partnerships, what is the platform for the success? And when I say there was like a private-public, so Roche is one of the strategic partners together with AstraZeneca, together with Pol Pharma, the local Polish pharmaceutical company, with Microsoft, with EAT Health, and with Medical Research Agency. So that's for me a nice example that public and private partnership can work. Of course, we are still at the beginning. But personally, I believe that this partnership will increase the resilience and also stability of post-pandemic healthcare here in Poland. And I hope this will motivate also other countries to start to think, what are those things we can really do much better? So just a few thoughts. And I can see Jan is raising his hand.
It's bursting, yeah, so I'll...
No, thank you very much, and indeed, I think the Warsaw Health Innovation Hub will be a great initiative, and I hope we can really we can really break some new ground there. And I believe, to your question, Craig, it's all about you know, as we are rebuilding, and sort of it's about preparedness. I think that shouldn't be forgotten, better resilience, but of course also recovery. And I think that will of course require fundamental investment. I think it's also good that initiatives like the Warsaw Hub there will of course also be leveraging some of that recovery investment that will be coming from the European side, but that will, frankly speaking, will not be sufficient to drive the whole transformation. So I think, and it will be challenging, I think, to mobilize, not only to mobilize the investment that's needed to support healthcare transformation, to better connected care, you know, leverage the advantages that can come also with digitalization, all of these pieces, but also to channel it in the right projects. And I think this is what we, of course, will try to do, the Warsaw Hub, but we'll do everywhere. And I think innovators now need to accept the challenge, and as they always had to, but I think if even there's a greater sense of urgency to focus, of course, on how we can rebuild and how we can transform, but we must do this in a very cost-effective way, because I think the crunch will come also from the economic side. I think everywhere in Europe, but also in Central and Eastern Europe. So we need to couple these two. We need to drive towards better outcomes. I think there's a lot of good learnings. We are embracing more technologies now that have been already there before, but there seems to be an acceleration effect. But it is going to cost a lot of money, and it will be critical to do that quickly. And then coming back to the beginning of the discussion, we must get the people on board. We need broad coalitions. We need the alignment of interests. It's going to be hellishly complex, but I don't think that any actor alone will solve this post-COVID recovery, so to say, in healthcare.
You just mentioned, you know, it's important that we focus on the right projects. I mean, have you got any kind of idea as to what kind of project that should be in terms of, you know, where should, you know, resources be going, whether they're public, whether they're private? You know, where should we be concentrating our innovation?
Yeah, you know, having this partnership announced, that was just the beginning. But before that, you know, we had a lot of discussions. What are the areas we as a strategic partners would like to focus on? And I was really happy to see that we were able to agree about 4 priorities for Poland. The first one is fight around lung cancer. And you're probably asking why lung cancer? Lung cancer mortality in Poland is really very high, the highest one. More than 20,000 people are dying each and every year. The second priority is strengthening the e-health. Also, COVID clearly showed, you know, that we are still living in the Stone Age, and we need to move significantly here. The good news is that also the Polish government is focusing in next 3 years to electronic medical records, using of artificial intelligence and telemedicine. So we believe that with that we can strengthen this pillar. And then Jan already mentioned, you know, outcome-based focusing. I would go even one step further on. We agree on that we would like to start the discussion about the value-based healthcare. So moving from one size fits all, moving from paying for each pill to really recognizing what exactly the value is. And then the last pillar is around COVID-19. What are those learnings we were able to gain, and how can we leverage this better? So I'm happy that we were able to agree about these priorities, and now you are asking what's the concrete project behind. We don't have a concrete project behind to share yet, but we are now submitting the ideas by end of September, and I'm pretty sure that by end of October we will have a much more clear picture. What are those projects we can really strive forward collectively?
All right, I'm going to come back to Kostas. What would you say, obviously speaking on, personally and on behalf of GE Healthcare, but, what do you think will be the lessons that, you both, personally and as an organization are, going to be taking forward now, a few key bullet points would be really good.
Question with a lot of possible answers. Let me say, first of all, on the innovation. I think innovation now is widely admitted that it's a cornerstone of going for the future healthcare landscape. We have endorsed in many aspects innovation also in emerging Europe. We have initiatives together with EIT Health, like Hello AI, which is a very extended training program for healthcare professionals, how AI, artificial intelligence, is implemented in medical imaging. What does it mean? How can they use it? What changes does it require in everyday routine and mentality? We have the Health Venture Lab, which is an initiative to support young startups on the field of health. We have the Reactor 21, which is another initiative to support young scientists that are on the medical imaging arena and facilitate them in the market access area. So many things there on innovation. But I think there are a couple of things that are not widely discussed and are very important. One is we discuss about resilience. I think Irma mentioned that, or Jan-Philipp, I don't remember. This is very much depending on quality. And we saw with this crisis in our area that a lot of local political crises erupted because there were big questions on the quality of the purchases as a response to COVID-19. So now that's the takeaway. How do we compromise quality in order to have volume that we need of equipment or anything else? And to what extent? Is everything acceptable? There must be some norms, some regulations. So I think that's a very big question that's staying unanswered. How can we, where do we draw the red line in the quality? The second thing which is very important is the local supply, the existence of local equipment and resources in order to address such a crisis without having relying out of Europe or out of the pole. So that's another thing. How can we be self-sufficient in manufacturing, in having some stock? And the European Union is talking about its organizing big stockpiling in different areas now in order to address such a gap that appeared with COVID-19. So for me, quality, number one. Innovation, number two. Education, number three. We talked before, you started with a question about vaccination. And we discussed about trust of people, but it's not only people. It's also healthcare professionals, because a very big percentage still of healthcare professionals remains unvaccinated. So I think education of healthcare professionals is very important. And we inaugurated this year in Bucharest a very big educational academy, SGE, to serve all the countries of Eastern Europe in the field of advanced visualization, medical imaging, use of our equipment. So these are the things that we can do. But I have to say that also, because I saw in the program that we discussed about how can we foster emerging Europe to surpass the rest of Europe, I think also that the governments have to play a very important role in softening the border limits in such things, in the licensings, in the recognition of trainings, of skills, to facilitate the movement of people, of goods, and of knowledge.
And is that a conversation that you're having? Is that something, that you're willing to take up?
We are trying to pursue this in a European level.
Because, to me, it seems that, we can speak here, and I know that, people like yourself and Irma and Jan-Philipp and, medical professionals, they often have, very good ideas, but ultimately you have to convince politicians and governments that, this is the right thing to do, and that is often the biggest obstacle.
It's a very good question. When you talk locally with some governments, they are very keen to collaborate with other governments, with other countries. So locally you can ignite this. But I think the mentality as a total in our 20, 25 countries needs a general level up.
Mm-hmm. Jan-Philipp, I'm just going to come to you because I saw you were putting your hand up again. I think you have a point to make here.
Irma first. Ladies first. You had your hand very clearly up. Please.
I didn't see Irma's hand. I only saw Jan-Philipp. Sorry.
Okay, thank you, Jan-Philipp. You are very kind. Yeah, I agree with Kostas, absolutely. For me, what is critical, it's a mindset shift. We are still seeing healthcare as a pure cost. And if we will see this also in the future, we will fail before we will start. So that transformation and mindset shift needs to happen as soon as possible. Because if we are honest to ourselves, we were discussing about the access, affordability, sustainability of healthcare for years. And what we were able to come up as a solution were just small incremental changes. And we know that with that, we will not succeed. So what we need to really do is significantly shift our mindset and see healthcare as an investment and really at the end, improving lives of our people. And by doing that, Central Europe or emerging Europe or Europe in general can become again a bit more competitive because end of the day, in last recent years, we are lagging behind United States. We are lagging behind significantly China. So I think now it's like a call for action to wake up. So mindset shift and really gaining back again trust to our citizens.
Now go, Jan-Philipp.
Yeah, no, just a few reflections on what was said. So I think first, I think that's also a conversation, Emma, from this switch towards, from sick care to health care. And then also, I think it's a conversation that ultimately also needs to convince the broader public and, let's say, the finance ministers and not only the health ministers, because that investment will be a longer term investment. So I think that case needs to be made. And I believe these kind of outcome-based, value-based models will be really important and everybody will be challenged to bring those on. But when it comes to this crisis preparedness and like crisis response part, I mean, I hope that some of the things that we learned will simply be implemented because they shouldn't be too difficult. Sorry to be blunt, right? But I remember a conversation early in the crisis with the EU Commissioner Lenarčič, who said, I have no visibility on availability of goods that are where we have shortages. We have no understanding of shortages in staff. We have no understanding on shortages on hospital beds and capacities, right? And it's very difficult to actually support the coordination also across borders to support countries to respond. And what's the ultimate reaction if in such a case is exactly what we saw. The countries would close down, they would close their borders, and ultimately they think that was a big failure for Europe. So I think we have to learn from that, and I hope that we will get much better visibility, better, of course, also elements like stockpiling, supply chain security. I think those need to be looked at European level. And then, of course, also I think the surveillance, the monitoring of pandemic threats ultimately has to be improved. I mean, the WHO now established a center in Berlin, together also the Charité, to monitor potential outbreaks. But there are, of course, also other threats around antimicrobial resistance or so, which I think really deserve careful monitoring. And I really hope that, I mean, often after such a crisis, this kind of wake-up call sometimes is needed to really change policy, change action in those areas. And I do see, to your question, Craig, that it does find response, it does resonate. I mean, also bodies like HERA, which are looked at being set up, I think there is response, but we indeed need to be as convinced Europeans really need to look at that it is not, they cannot only be national endeavors, but they need to be European and they need to be globally linked. Otherwise, I think we will not be in a better place if this happens again.
Okay, so you're generally optimistic that, this wake-up call is going to, be used in the right places to, focus minds a little bit.
I'm an optimist by nature, but I think there is some reason also to be optimistic. I mean, I do believe that that of course there are now also very ambitious plans coming up on what role the EU should play in healthcare in general, because it has played usually a very little role, and there are the ideas around creating a health union and so on. And I don't think that all of the most ambitious pieces that have been put forward will ultimately become reality, and maybe not all of them have to. But I think around better preparedness, monitoring these resilient factors, and also fully linking data better across borders and enabling us to monitor that. I dare think that this will become better, because the consequences of not doing that and being so poorly prepared have been so dramatic for everyone that I think we will see some response that is also meaningful and good.
Okay, I mean, one final point now, and one final question, if you like, and I'll start with you, Kostas. Where do you see the next big innovation in healthcare? I mean, we had a similar conversation, I think with a colleague of yours, certainly with a colleague of Jan-Philipp's from EIT about 6 months ago. And, I think the quote that she gave us, I think it was a colleague of yours, Jan-Philipp, I can't remember her name, but she said, not to use AI in healthcare will soon be malpractice. She was convinced that AI was going to be where the next, that was going to be the next big thing. I mean, do you agree, or do you have other suggestions? Or?
It's not a matter of discussion. I think agreeing or disagreeing, AI is everywhere, and either you use it or you stay in a non-competitive situation. I think it's a very difficult question to say where would be the next big innovation in healthcare, because we know that everybody works in very different directions and frantically, especially after the COVID crisis. And we know that the European Union is really fostering this, at least in Europe, this research efforts with a lot of grants and funds behind. So a lot of things are cooking. Let me say that SGE, that we did a lot of AI revolutions. One is, for example, with the COVID-19, the thoracic care suite, an algorithm that is used in usual X-ray machines. I think it's one of the important lessons with the crisis is that we saw the value of the classic X-ray, the very, very first invention in medical imaging from the beginning of the 20th century, Marie Curie and Röntgen. We saw the value of it. Still, 60% of all the medical imaging exams globally is classic X-ray exams. So GE created this algorithm that can really recognize 8 abnormal findings and triage the patients in tuberculosis, pneumonia, or COVID-19 patients, and can proceed then very fast in the right treatment. In order to do this, to create this algorithm, because we say algorithm and people think it's a mathematical function, it is, but they used 200,000 X-rays, data from X-rays, existing exams. You can understand this is a huge collection of data.
They obviously had access to those, and access to data, access to records, that kind of thing. It's a whole other discussion, which we probably don't have time for. But
yes, I have to say that nobody has access, not even us, of course, to the medical exams that our customers are doing. You have to find the data, you have to agree, and you have to find the exams that are of different quality. So if you have, let's say, a big hospital next to you having these 200,000 exams, it doesn't make you able to use the algorithm. You have to find different quality and different body types and different technologies, methodology, users of X-rays globally in order to train an algorithm to be able to recognize these findings. Another very important direction is we took the artificial intelligence not in the field of visual recognition and the field of diagnosis of examinations, which is something that everybody early recognized that it's a very, very big use, critical use of AI. We took it one level earlier in the scanning, in the acquisition of data. And this started with MRI. So there are special algorithms, AirRecon-DL, for example, that they filter the signal at the source when it's coming to the equipment, let's say, roughly for the people to understand, and they can reject the noise. And as a result, pictures are coming, exams are coming much sharper, the image quality is much bigger, and the scan time is much smaller. So you increase productivity, which is a very big issue of the healthcare systems, the overcapacity, the excess of patients. We heard Ms. Tsiskachnia from a leader of Democratic Belarus before saying that she will see dreams of a Belarus where people have access to medical equipment. So we solve capacity issues and we solve quality of diagnosis issues like that.
All right, thank you. Irma, I'm just going to come back to you. I mean, we're running out of time. We've got a couple more minutes. A brief summary, if you like.
Yeah. I would say it's not so much about the innovation, because, you know, innovation is here. For me, it's more like how to bring this innovation to all of us, because currently just a small piece of humanity is deserving this, is getting this. But personally, I believe that humanity deserves better. So for me, first step, you know, before you start running, you need to walk. And for me, this shift from one size fits all towards personalized healthcare should be our ambition. And last point from my side is COVID-19 for sure will find a place in history. Books will be written about that. But let's make sure that all the suffering wasn't for nothing. Let's work together so that the future generation could say that year 2021 was the year when the next revolution started. Because we need a revolution. Incremental changes will not help us. And personally, I'm the optimist, similarly just like Jan-Philipp. So we have what it takes. We just need to do it, and we need to do it together.
All right, before we close, let's have one burst of your optimism, Jan-Philipp, just to... just so that we can leave on a happy note. Go on.
You know, I just wanted to jump on what you said you didn't want to discuss, which was the data question, but I actually...
That's because we don't have time. I know it will take about 3 or 4 hours to cover it properly.
Just joking. But I think, you know, really big data, somehow ecosystems are so important because we got all these digital applications coming now. And if we don't find a way that we really leverage big data, and I think there is, in the end, ethically, I think we need to organize that there's an obligation almost to share, because in the end, we cannot leverage the advantages of these technologies if we don't have big data. Contrary, if we will have applications in whatever form that will leverage small data, so to say, I think they could actually become bad, right? They could have detrimental effects. They really need big data for us to succeed. So I don't know, Irma and Kostas, how we're going to do this. Maybe the Warsaw Health Innovation Hub will also be a place to discuss this. But we do need, I think, to find a way to get, we need a model, how we can leverage big data, big and broad, for many actors, not by just occupied by one, but to enable innovation as a big driver.
Absolutely, fully agree with you, Jan-Philipp, and that's maybe a topic for another 1 hour discussion, because that's the core.
All right.
Thanks so much.
All right. Well, thank you to the three of you. Thank you to Kostas. Thank you to Irma and to Jan-Philipp. And I look forward to speaking to you all again sometime soon. Hopefully in very different circumstances, and you know, COVID won't even be mentioned. So you know, that's something to look forward to.
Everyone.
Bye-bye.
Take care. Bye-bye.
Thank you very much, Craig.